Hi, guys. So, when I was going through my pregnancy, I had so much anxiety. I have, I guess you would call it a medical phobia. I get really anxious when I go see doctors. And so much so that it affects my blood pressure. It's this thing called white coat syndrome. My OB said it was the most extreme form of it he'd ever seen. So you can imagine what that's like going through so many appointments that you have to go through in a pregnancy. And especially with mine, because of my age, it was considered high risk. So I had a lot of extra scans, tests, appointments that were built into that whole thing. And while I was going through all of that, I kept looking on YouTube to see if there was like anyone describing experiences like this. I felt like I couldn't have been alone in having a medical phobia and struggling with that so much in pregnancy. And I kept wondering, like, how all the other women who were like me, which might be a small minority, but still, got through their pregnancy. And that's not even factoring in the anxiety, the natural anxiety that you have for your baby and hoping everything's okay, especially in the first trimester, but that fear never really goes away because there's always the chance of loss in some way. So, I just wanted to get on here so I could describe what it was like for me and things that I did that helped make it a little bit better. Unfortunately, nothing eliminated it entirely. I can't say that, oh, during my pregnancy, I got rid of my medical phobia through like exposure. I went to so many appointments, I just like got over it. I wish I could say that. That didn't happen. But there were a few things that for me helped. And if you're in the same boat, I wanted to offer this to you in case it might possibly help you. Okay, so the first thing is if you're with a provider that you're like on the fence about, please, even if you're pretty far along in your pregnancy, look for someone else who you might feel more comfortable with. Particularly people who are uncomfortable in more like strict medical environments. Take a look and see, is there a midwife in your area? Is there a birth center or something like that? Or even a doctor who sees patients in their home. That might just the change of lighting and scenery for you might make a really big difference. And I can tell you that I moved cities when I forget how many weeks I was, but I think it was like the end of my first trimester, let's say. And I felt like, oh my gosh, it's way too late to start to establish care with a new provider, but I had to, right? Because I was moving cities. And when I looked up my provider, I saw a review for him, maybe even a couple, where women switched to his care when they were like 8 months pregnant or something. And because they liked him so much, they just wanted to make sure that they could do whatever they could for him to deliver their baby and for them to be in his care, under his care, for the rest of their pregnancy. So it's not too late. I understand there's limiting factors like access and, what your insurance will cover, but do the best that you can to find someone that you feel comfortable with or even just slightly more comfortable with. And don't blame yourself if you're with a provider that gives you like an off feeling, and that provider could be perfect for your best friend and not for you. Everyone's different when it comes to their care and what makes people feel comfortable. The next thing I would say is, for me at least, if you're dealing with something specifically to white coat syndrome, what my doctor let me do was he let me monitor my readings at home, my blood pressure readings. I would record them and I would bring them in. So he would get a high reading when I was in the office, but be reassured by the fact that this wasn't a chronic issue. He didn't have to give me medication for my blood pressure. It was just an acute situation that happened at the doctor's office, unfortunately. The other thing I would say is if you don't already have a therapist, consider getting one. Because something that my OB said to me actually turned out to be true, which is he was like, you're dealing with anxiety now. And what typically happens for women who deal with anxiety and depression during their pregnancy is that they're at an elevated risk for PPD, postpartum depression, when after they have the baby. And I remember telling him, like, no, I'm going to be fine. As soon as I don't have to like go to the doctor every week anymore, like I'm going to be very relieved and happy. But the truth of the matter is, when you're riding those stress emotions for so many months, and then you finally get to this like crash, and you're exhausted and you have a new baby and all that entails, it really makes sense now looking back that you are at an elevated risk for depression. So, and that certainly happened to me. So it's beneficial for you to establish care with a therapist during your pregnancy, and not just for everything you're going through during your pregnancy, but that so also in the postpartum period you have that support built in, and you don't have to. I mean, trust me, the last thing I would have wanted to do during postpartum is like search for a therapist that I feel comfortable with and that I can afford. Like, you already have so much on your plate. Please try to do everything that you can to get those ducks in a row now. So on that note, I was screened for, like, I spoke to a psychiatrist during my pregnancy to see if going on some medication for my anxiety might help. But the truth of the matter is, for me, my anxiety was very specific to doctor's appointments. So it kind of it didn't make sense for me to go on an antidepressant or something to treat my anxiety, because in my regular waking day I wasn't having those symptoms. But I worked with my OB and a psychiatrist to find something that I could take just before going into the hospital for labor, because I had so much anxiety about that. I was terrified that my OB wouldn't be available. He wouldn't be able to deliver my baby, that all this white coat syndrome was just going to hit a fever pitch. And, I was going to, I don't know, all kinds of worst case scenarios with like my blood pressure going up, and, now I'm in a seizure and just all these terrible things happening. So what he ended up doing was prescribing me some beta blockers, which essentially, as far as I understand them, they just sort of block that adrenaline response in your body. So you can be nervous, but you're physically not feeling the effects as much. So the way it feels, it doesn't alter you in the sense of making you feel like euphoric or fuzzy or anything like that. To me, it more just felt like it brought my anxiety down. So if my anxiety on a scale of 1 to 10 going into labor was like, say, a 9, with the beta blockers, it felt like it was more like a 7 or a 6. So it didn't even like super drastically reduce it. It just reduced it enough for it to be manageable. And that was really, really helpful. And I want to stress that he was adamant about me only taking this for this very specific reason, going into labor. He didn't even want me to take them when I was going into the office to see him or for any other doctor's appointment, because you're really not supposed to take them during pregnancy, because I think there's a risk of growth restriction, of intrauterine growth restriction, where the baby's growth is restricted and they come out a lot smaller than they should be. So he only prescribed it to me when I was like in my 8th month. I got them filled, but I never took them until we were like on the way to the hospital. But I guess this is a long-winded way of saying that if you are in need of medication, whether it's for an acute situation or whether it's an ongoing situation, medication is out there and available. So please don't feel like you're stuck. Okay, so I talked about the therapist, the medication, finding a provider that makes you comfortable. Yeah, and the last thing I would say is do the best that you can overall to advocate for yourself, whether it's in your appointments, for your birth plan, if that looks like getting a doula for you or a postpartum doula or both. Do whatever you need to do that makes you feel comfortable. You'll hear over and over again, like, you go in with a birth plan and then, kind of like boxing or whatever, where I think Mike Tyson said, like, everybody has a plan until they get punched in the face. So it's true that you might go in with a plan and it gets changed, but that doesn't mean that you shouldn't do everything you can to make yourself feel comfortable and to have a plan going in. Yeah. So I hope that's helpful. And if you're going through a pregnancy and you're super duper anxious and it's bothering you, I hope you found some help in this video. Please comment below and I'll do my best to reply to everyone. I feel very passionately about trying to help new mothers that are going through mental health issues like this, because it was so difficult for me and I wished so badly to have certain types of support. So I really want to provide that support in any way that I can now. All right, thanks.